Welcome to the MDA Engage webinar focused on caring for oneself with ALS during COVID-19. My name is Elise Qualley, and I am the Director of Community Education and Insight for the Muscular Dystrophy Association. This webinar is part of MDA's Community Education Series, MDA Engage. Throughout 2020, we will be hosting a variety of disease-specific symposia, general community education seminars, and community webinars. These events are focused on providing valuable information and resources to the MDA community. We know this is a time of great uncertainty, and caring for yourself is vitally important during this time. I am thrilled to have Dr. Ambereen Mehta and Hillary Zebberman with us today to share valuable information, tips, and tools for taking care of yourself, whether you are someone living with ALS or a caregiver of someone with ALS. Both Dr. Mehta and Hillary are part of UCLA Health in Los Angeles, California. So let me tell you a little bit about our speakers. Dr. Ambereen Mehta, MPH, is an assistant clinical professor of palliative medicine in the Department of Internal Medicine. She completed her residency in internal medicine at Johns Hopkins Bayview Medical Center and her fellowship in hospice and palliative medicine at the National Institutes of Health in 2016. After fellowship, she was part of the palliative care faculty at the University of Virginia. She was recruited to UCLA in 2018, where she is part of the inpatient palliative care consult service. She sees patients in the multidisciplinary ALS clinic as a neuropalliative specialist and conducts research in neuropalliative care and education. Hillary Zebberman is a licensed clinical social worker. She graduated from Wurzweiler School of Social Work, Yeshiva University, with her master's in social work. In addition to years in medical social work experience, she has a background working with children, adults, and families in the areas of neuromuscular disease, medical genetics, epilepsy, and development delays. She provides psychosocial assessments of each patient and a treatment plan based on the individual and family needs. So I would like to thank Dr. Mehta and Hillary very much for their time today. Webinars such as this could not be possible without the generous support of our sponsors. I would like to say a special thank you to Mitsubishi Tanabe Pharma America for supporting this ALS webinar. And with that, I would like to turn the presentation over to Dr. Mehta.
Thank you, Elise, and we want to thank the MDA for helping to organize this. Hillary and I have no relevant disclosures. So today we're hoping to share in an informal way some helpful information for our patients with ALS during the coronavirus epidemic. We'll talk about some of the social distancing and what it is and why it's important for patients with ALS, but also how to remain emotionally connected to each other at the same time. We'll talk about some of the medical considerations for patients with ALS and how these are related to coronavirus. And we'll share some tips and resources for how to care for oneself as a patient with ALS and as a loved one caring for someone with ALS. So, what is social distancing? Let's talk about that and why it may be especially important for patients with ALS to take some extra precautions. Patients with ALS may have weight loss or deconditioned already. They may have difficulty with breathing already. Some may already require support with non-invasive breathing machines like a CPAP or a BiPAP, or they may actually already be on a ventilator. And all of this puts patients with ALS at risk for getting seriously ill with coronavirus, and it may be harder for them to recover. So keeping distance between us helps to minimize the spread of the virus. That spreads by droplets in the air that we then breathe in. And it can also live on surfaces, some surfaces longer than others. which is why staying 6 feet apart and washing our hands and cleaning surfaces regularly can really help reduce the spread. Wearing masks when we're caring for a vulnerable patient can really help to keep them safe. And I think those are some of the important reasons why we practice social distancing. Even with distancing, it's actually okay and encouraged to leave the house for essential errands like picking up groceries, medications, and even brief periods of exercise, and to get some sunshine. Even with these activities, we still take precautions while wearing masks, washing our hands when we come into the house, and still staying away from others while we're out. But sometimes people need a change of clothes in the garage, or they'll put them on when they get home, or they'll shower when they enter the house. And you may not be able to take your loved one out with you if they have ALS and are more vulnerable to the store. But sometimes I've had patients just take that person along with them in the car so they can get a little bit of outside exposure. Some of the medical considerations that we should talk about briefly that coronavirus brings up for patients who have ALS are that there can be an overlap in some of the symptoms that patients with ALS may have with coronavirus. Fatigue and difficulty breathing are some of those. And if you start to have these symptoms, or you have symptoms that are starting to get worse, those are things to talk to your physician about. Some of the symptoms that are actually more specific to coronavirus are GI symptoms like nausea, vomiting, diarrhea, loss of taste and smell, and fevers. So if you have any questions about any of these symptoms, you shouldn't hesitate to ask your medical team or to seek out the help from them. And it's important to recognize that coronavirus and social isolation can really bring about feelings of anxiety and sadness. Some of these feelings are normal, but it can be hard to know whether they're serious and whether they need medical treatment. Mental health is an important thing for patients and their families to be aware of. It's normal at times to not feel like yourself or to find yourself feeling blue, especially when there is change. And right now with coronavirus, there is a lot of change and uncertainty happening. So you should talk to your doctor or your medical provider. And if you have a therapist, talk to your therapist about the feelings that you're having. You should talk to your physicians if you have a history of diagnosed mental health issues like anxiety or depression. And with or without a diagnosis, if you start to have symptoms that are impacting your ability to get your daily activities done, you may need medical treatment. If you're unable to enjoy things that usually bring you joy, or if you're having feelings of hopelessness or guilt, those are things to talk to your doctor about. In fact, sometimes symptoms of depression can overlap symptoms of ALS. Feelings like fatigue, or if you're starting to have poor appetite, or you're having changes in sleep, even sometimes more sleep or less sleep, or you're having trouble with concentration. Those may be signs that you have depression, but maybe also signs that your ALS might be progressing. And so today, we're going to talk about some tips and resources on how to alleviate some of the feelings that you might be having. But if you're finding that they're not really improving, that's when to talk to your doctor. And I've been talking a lot about really talking to your doctor, and in all this time of social distancing, that may be difficult. So talk to give them a call. Some of them are already setting up ways to talk to patients through telemedicine. And we're actually going to be having another webinar through the MDA on telemedicine. So stay tuned for that. Hillary, what do you think?
Okay, so I think you gave some really good information, and I'm just going to jump on that and talk about what we can do when we're in our house and with our own environment to help keep us feel happier and not as anxious. And we're not alone. Everybody is feeling this way because there's a lot of unknowns. So one important thing that I'd like to talk about is limiting your resources that you're listening to. We could be listening to the radio, to social media, we can watch TV and the news, and it's all over the place, and that's all they're talking about is this pandemic. And you need to pull yourself away from it a little bit and find maybe one or two sources that you're listening to, and try to take the other parts of the day, and we're going to try to give you tools to help you calm yourself and be able to move on and get some enjoyment out of your days. And then another thing is that being home, a lot of us can't go out. And for those of us who have been in the house all the time, those of us who haven't been able to get out due to illness, we aren't having our visitors coming in. Some of us can't even have some of the home health nurses or the therapists that used to come in and that we looked forward to seeing. So we have to combat loneliness and both for the caregiver and for the patient. And we're going to give you some tools for that. But I have learned so much from the caregivers that I speak to and from my patients. Many of them have set up Zoom meetings with their families. We're from anywhere of 2 to 10 family members once a week, twice a week. They have, and then we're going to go into some of those other resources to help you connect. But if the internet isn't something that you do, one of my elderly patients, she can't use the internet at all. She's on the phone all day long, touching base with people that she knows, whether it's her priest or whether it's her sister-in-law or nieces, nephews, and just talking to everybody and trying to stay away from the news because it can inundate you. So, these are ways that we can take control.
Absolutely. I think that's exactly right, Hillary. And, especially for patients who have ALS, they may have extra logistics to consider too, like difficulty with transportation or difficulty with communication. During such an uncertain time, we all want to look for things that we can control. And instead of worrying constantly about what may or may not happen, we should think about things in your life that you can control and focus your energy on those. So what are some of the ways that you can do that? Talk to your family about your wishes that are related to coronavirus or not related to coronavirus. And, it is difficult to talk about what you would want if you become seriously ill, but it's even harder to do that if you can't talk to them about it and they don't know what you want. It becomes an even harder situation. Hillary and I, we often tell our patients that these conversations are really gifts that you can give your loved ones who may be called on to answer some of these difficult questions. And having these conversations regularly can really normalize them and make it less scary and intense. In fact, it's not all scary or sad. You get to think about what's important to you, what brings you joy and meaning and value. And some of these things are great for your medical team to know about how to care for you well. So sharing some of these things with your family may even bring you closer together. You may find yourself learning about each other in new ways and sharing information that you weren't expecting to. Hillary, one of the things that you actually mentioned about caregivers coming and going from the house, I think is something that has been on people's mind a lot. A lot of patients with ALS and their families, they have and really need to continue having caregivers come to their home. And services like hospice or home health. And I think it's important to just say here that it's okay to let them come. But just like we were talking about, being prepared. So talking to your home health services and home caregivers about a plan and doing that regularly and adjusting that plan as you need to can really be helpful. Tell them what you're comfortable with. Ask them about the protective equipment that they have and what their plans are and how to use it. And you want to really help each other take care of you and your loved one well in this time. So, I've had families and patients keep an area of the house separate for when the caregiver comes. So not only is the caregiver not exposed to the whole house, but the whole house is not exposed, and then you don't have to clean up so much after they leave. Or you may have young children or other vulnerable people in your home, and you may want to keep them separated while that caregiver is coming into the home. And that way, once they leave, everyone kind of cleans up and washes and makes it a little bit easier. Have you had patients talk to you about that, Hillary?
Yeah, and like you said, some of my patients are quarantined to a certain part of the house. They have their own bathroom, their own den area, their own bedroom, and then whoever comes to see them is screened very gingerly to make sure that they're going to minimize any exposure. And in that way, the home can still be used for the rest of the family. So, So one of the things we're going to be talking about is developing new skills, because we're going to have to rewrite what we're doing with our days and how we're doing these things, like reaching out to people. And one of the great resource that I discovered, and it actually was through one of my patients, it's a resource called Get Set Up, and it's free, and it's classes on how to handle how to handle technology if you're not somebody who is necessarily computer savvy or cell phone savvy. And it's taught by senior citizens, as it happens to be. And they have all sorts of classes, like how to set up a Zoom, how to find different college classes on your computer that you can get for free, or how to set up an Uber app on your cell phone, or how to order food through your cell phone being delivered to your house so that you don't have to go out. And a lot of us who haven't grown up in this technology world can maybe shy away from it and not be able to enjoy the resources that are now exploding, that are available to everybody. So speaking about resources and developing new skills, once you develop your skills through technology, there's a whole world open up. There's free classes that are offered through hundreds of universities all over the world. And there's a website called Open Culture, and it actually lists many of these free, like 250, actually I think it's more, courses from learning about child development, learning about different science questions, learning about farming, and it can expand your mind. And these are things that can bring us mental health, can boost our mental health, make us feel better, because we're doing something with our day. We're creating a growth inside of us that is positive. There's virtual vacations that you can go on. There's National Geographic sites that can take you through Yosemite National Forest. I mean, it is absolutely amazing. So you might be confined to your home right now, but there's a whole world out there that you can access. And I can't stress enough how wonderful it has been for many of my patients and for my caregivers who are stuck at home. Don't be afraid to ask your friends for help, or family for help, and to take advantage of all these resources. And we're going to explore more resources later on in this lecture.
Hillary, I learned today, I had a colleague who helped a 90-year-old set up their video technology so they could do their visit. And I think that in and of itself was a new skill that they learned how to do, both the physician helping and the patient who got the benefit of that.
Amazing.
I want to know what skill you've been learning.
Oh my God. Since I've been sheltering at home, I've learned how to use Zoom. I've learned how to use haiku on my cell phone. I went out and got a special cell phone so that I could do telecommunication visits with my patients. And I'm learning about all these resources that I'm teaching you guys about, because
It's wonderful.
a lot of these things, just didn't necessarily come up in my day-to-day life for either myself or from my patients or my colleagues. So I have to keep on reminding myself, you're learning something, you're expanding your mind. These are all good things.
I'm learning how to do some basic cooking skills. Basic is the important word here. So what are the ways that we can stay connected? Are there some resources that you've been finding?
Yes. Well, as we've listed here, some of our patients and caregivers have told us about family game nights, where people have found an app where different members of the family from across the country could Zoom in on a card game or a trivia game, and it's a good way to keep connected with people that you love and that you want to be with. There's virtual happy hours. Now, for me, somebody said to me, "You're telling your patients about a virtual happy hour?" I don't need a drink to be happy, so I don't even think of it that way. I just think, oh, I'm going to get on the internet and talk to all my friends and be happy. And I think that that's what you can do. And maybe cooking together remotely, or coming up with menu ideas. There's also online support groups that are through different organizations. The way that different organizations have rallied together to help in this pandemic is absolutely amazing. NAMI, which is the National Association for Mental Illness, they have wonderful resources both for individuals and for caregivers, and different types of groups that you can hook up with to speak with people. And all of us have our mental challenges, especially in a pandemic time like this. And so it's the new normal to go out and be able to ask for help and be able to say, yes, I'm having these feelings and I need to connect and I need some help. You can also call info line 211, which is it is a free 411 where you can ask for any resources, and if you need a support line that you need to talk to somebody that you are lonely, they'll hook you up. They'll find out what your age and what your needs are and hook you up with somebody to speak with. These are all ways that you can help with your loneliness and stay connected to your community. And
that's wonderful. I'm actually going to a wedding this weekend. It was a friend who was getting married originally, and instead of doing it in person, we're doing it virtually.
So, and what are they charging per seat?
The only thing that is my request for attendance is to take some online photographs. So that's what they're charging. And you have to bring your own drink.
Okay.
Alcoholic or non-alcoholic.
Well, something, this might be changing the way that we live. No more, you can have more people and use less resources for it.
There are so many creative ways of sharing with each other. I thought this was a great example of that, So still social distance sing. We could sing across to each other or maybe do some dancing. I certainly know the folks in Italy have been doing some of that. And there was a recent Broadway singer hanging out his windowsill in New York just the other day. So we got to find our creative outlets.
Well, I think there have been a lot of creative things that I have seen coming across, people sending me little blurbs or little pictures and texts, and it just amazes me how people are rising to the occasion to make something good out of this pandemic.
Absolutely.
So what are some of the things that can help sustain your mental well-being during this period, and probably always? I had just been looking into something called mindfulness, and there's a website through UCLA, and it's called the Mindfulness Awareness Research Center, and they have all sorts of free classes, free what do you call it, podcasts?
Yes, yes.
Listen to, and they actually use this a lot in the hospital with our patients.
Mm-hmm.
And the mindfulness is actually a way of helping you be in the moment, enjoy the moment, and not be thinking about the past and the future and all those ideas that float around us and get in the way of us enjoying or experiencing or taking in positive things. And you don't have to leave your house. You don't have to go to an appointment to talk to anybody. You can just, and it's something that you can learn, a skill that you can learn and do for and by yourself. And anybody can do it. You don't have to be mobile to have to do it. And so this resource through UCLA is really, really great. And then there is also another resource called Headspace, which is also you can access through the internet, and they also have classes and explain what mindfulness is and how it could help you. And all you have to do is take the time and risk the 10 minutes or a half hour of listening to an introduction and seeing what it's all about. It's also we find one of the social work questions that I ask when I go into a room is, do you have a spiritual guidance? What is your religion? Are you connected to a spiritual community? And this is also another way to help take some of the stress or the anxiety off of your shoulders. People who are part of a spiritual community have other people to share their feelings with, and to connect with, and so all of us can find a different way of trying to deal with our stress. Dr. Mehta, you were talking about yoga.
Yes.
There's some type of free yoga app, and I'm not like a yoga person. I thought, could you just tell us a little bit about what you know?
Yeah, sure. There's so many resources online, and these are some of the great ones that you mentioned, Hillary. And there's some others that are like, there's one company called Down Dog Yoga. It's free right now for a trial period and has a nominal fee, but I really liked it because they have a lot of examples for patients who, really for any level of activity that you're accustomed to. If you can only do yoga seated in a chair, they have yoga for people who can only be seated in a chair. They have everything from, there's all sorts of, that's just one company and one website, but I've seen so many options explode for ways that people can stay active at home as well. And yoga and Tai Chi is another one that have videos online or have free subscriptions for folks to really try that out. And so you don't have to be limber or experienced at all with it, just giving it a chance to move your body in different ways, and doing it with a friend or a loved one, or virtually or in person. It's kind of another way to connect with each other. And I really liked your talk about mindfulness. I think it's important because there's such a strong mind-body connection, and how our mind is feeling can affect how our body is feeling, and vice versa. Mindfulness is really a way of being able to be present in the moment, and can teach you how to channel your feelings when you're feeling overwhelmed or anxious or frightened. And so there's so many different ways of taking care of yourself, and some of these resources are examples of those.
So we're going to be needing to rewrite our daily norm. My daily norm was getting in the car and driving 30 to 90 minutes to go into the office. And
LA traffic.
yes. So not all of this is so bad. Although I do miss my connections with my patients and my colleagues and being, you know, in the hospital or on the campus. But, you know, you have to take, you can make lemonade out of lemons. But so, you know, we were thinking about some of the things that can help you with your daily schedule. And you do need to have a daily schedule. And we're recommending that your day starts as if you're going to work. You get up, you get dressed, you try to look your best, and look at it like this is your job. Your job is to plan out a day, whether you're the caregiver and caring for somebody, or whether you're the patient. And we have given you some tools that you can look at in terms of maybe learning a new skill like we spoke about. And it's very, very important. And it's very important, and we're recommending that people actually write down a schedule of what they're going to do starting in the morning, whether it's a TV show that they're going to watch, or pick up a book and read it, or call a friend, or get on a Zoom meeting, or go on a virtual vacation, that you have something that you have planned for throughout the day. And this will keep you in a healthy space and help you to connect with others, help your mind to expand, and it'll help you stay as healthy as possible during this very, very trying time. We're all going to look at the world differently from now on, and hopefully you're going to be connecting either with however you can with technology or learning something, and reaching out to groups and organizations and trying to stay connected. Now, some of it sounds like it's overwhelming. You can do it in little bitty steps, and that's what I wanted to share with you.
Yeah, that's great. You know, I've actually had some patients tell me that now that the kids are home or doing homeschooled activities, they get to see their kids a lot more, and they enjoy being able to actually connect with them in a new way. Some patients with ALS, their children have been more involved with their care now that they're home, and they've really found a lot of joy in that. So new norms and new routines.
So it's really very important for our caregivers to take care of themselves. And, you know, sometimes they're running back and forth and under so much stress, taking care of the house, taking care of their patient, taking care of their other relatives. So you need to give yourself permission to take time out of your day every day to do things for yourself. And one of them is to think to yourself, why am I always running and doing for others and not taking time for myself? Am I feeling guilty? Am I feeling like nobody will be there to care for my loved one for those, you know, for that half hour or for that day? And how could you solve that feeling of guilt and make sure that you know that everybody's going to be taken care of and that you can take care of yourself? And one thing is to reframe your thoughts, that you don't have to fix the entire situation for your loved one or for yourself. You could take baby steps, and you could, you know, take control of your situation, and by taking steps to take care of yourself. And one of the things is to make sure that you take care of your own health needs, your own emotional needs, and your own mental health needs. And I like to compare it to a parent that's in an airplane that they're saying that you have to put oxygen on. If you put the oxygen on your child first, then who's going to take care of you? You have to put your oxygen on yourself first. You have to take care of yourself so that you have the reserve to take care of others. And, you know, we're recommending, like we are for everybody, that you make sure that you have a good diet, that you're exercising, taking breaks throughout the day, and that you do this without feeling guilty. Because if you're not taking care of yourself, you can't take care of others.
Yeah, absolutely. We want to try to prevent caregiver burnout, right?
Right.
And Hillary, how are some of your patients handling childcare needs with this new shift in daily norms?
Well, a lot of employment, especially for healthcare workers, are still keeping their on-site childcare open so that the children have a safe place to go and that the parent can work. Some parents are needing to stay home and just work out of the house, and it's a big challenge because kids are running around and they're trying to have Zoom meetings for work or place calls, and they are finding it really challenging. But they're, again, through the internet, there are, support systems for this, and there's 101 ways to keep your child alone time and entertain themselves while you make a phone call. And people just have to be creative.
Yeah, absolutely. So what are some of the, are there some, I think like you were talking about, some stress reduction exercises that folks can do together, really taking care of their own healthcare needs? Would you encourage people to actually build those into their daily schedule that they write out and say, there's time for me and time for you?
Yes. That's what I'm suggesting, that to have a very formal written out schedule with it.
That's great.
As if you're running a preschool. When you have a preschool, you have, come in, have breakfast, we're gonna do some drawing, then we're gonna take a bathroom break.
Yeah.
Then we're, gonna have story time, we're gonna have nap time. Because if you write it and you have it in a schedule, even if you don't look at the schedule, it's going to be in your mind, and it's something that you planned for, that you can control, and that you can give a glance and to remind you to take care of yourself.
That's a great point. That's a great point. Now, are there some resources that patients can access through Medicaid or that you know of through senior centers?
Sure. There's a lot of there's resources to help pay for caregiving needs, and most of them come through the Medicaid, so that you have to be below a certain income level to access caregiving reimbursement. But there is ways to get a special waiver for Medicaid. I know in the state of California there is, and I'm sure that there's other programs in other states. In fact, I know there is, because I've looked into it for some of my patients that are either moving to other states or have moved and have called me for help. In the state of California, we have something called a home community-based waiver program, and they could help you get something called spousal impoverishment Medicaid. So if you have a spouse that needs caregiving, and the two of you have a combined income that's not at the poverty level, not at a level where you would be able to qualify for Medi-Cal, your spouse could actually qualify for Medi-Cal. And because the whole goal of it is not to deplete the family, so that the surviving spouse and family doesn't have anything left after doing all the caregiving for their relative. And there's also different emergency resources that actually, you can look it up on the internet, but the National Organization for Rare Diseases has put together an emergency fund. And I know that some of the other agencies have followed suit. So you just have to look it up on the internet. The other thing is that if you're not internet savvy, if you call 211 from your home phone, it's like a free 411, and you could say, this is what's going on. I'm over 65 and I we don't have food, I need more money to pay the rent. Where can I go to get help? And they will give you phone numbers to call.
Great.
Also, a lot of the senior programs, if you're over 65, they have, like the senior citizen centers, they have often access to resources that they can point you to. Sometimes they're able to get extra funding for caregiving, for housekeeping. So I always encourage people to call their local senior center. And also, another thing I encourage people to do if they're looking for resources, especially for financial resources, is to call your local hospital's medical social worker, because they'll know what's in the direct area of where you live and can point you in the right direction. And the Muscular Dystrophy Association has a great resource center where they're staffed with people ready to help you. And if they don't know the answer, they're ready to do the research to find out what resources can help you financially. And you just have to do a little hunting around, but there is help out there.
Those are great resources. I think that, knowing whom to reach out for, even if you can't do it yourself, is really, really great. And recruiting family or friends or neighbors to do some of these things virtually, where it's a phone call, or maybe helping get you set up with video services or things like that. Those are really helpful tips for some of the patients who might be limited in their resources.
And also if you go into the internet, the World Health Organization has phenomenal slides and little leaflets, and they list resources that you can turn to. So if you go to type in the World Health Organization, you could put COVID-19 and a lot of things will pop up. And also the Center for Disease Control and Prevention. And by the way, these are like positive things that you can do when you're hunting around for information on COVID-19. They'll give you positive things you can do to take control of the situation and to know that you're getting the right information.
That's right. And we've talked a lot about mental health and really how caring for that is very important. There are even therapists that are available online, but just make sure that you check out their credentials like you would for anything else. There's a wide range of experience and qualifications out there, so we just really want to make sure that you're being thoughtful about who you're connecting with, but those are resources that are also available online. Hillary, are there other resources that you send patients to for mental health that you could share with us?
Yeah, I suggest that they ask their primary care physician. And also, if they can't get a hold of their primary care physician, usually on the back of your insurance card, there's something that says behavioral health. You can call up and you could say, I need help. You don't even need a referral from your physician. And they will hook you up with whatever mental health. They'll have somebody evaluate you over the phone and give recommendations for what kind of help would be best for you.
Yeah.
But if you're feeling lonely and you're feeling scared and you have nobody to talk to, you can always call Info Line 211, and they can give you supportive telephone numbers of helplines that you could speak with. So you're not alone, because everybody is going through this, and people are going to experience it in different ways. And just make sure you are ready, that you will ask for help. That's what we want you to do.
Yes. Yes, absolutely.
Perfect. Well, thank you so much, Hillary and Dr. Mehta. That was a lot of really great information that you just shared for the ALS community to help them get through this time of COVID-19. I loved all the resources you shared. I also loved how you talked about learning new skills. When you were talking, I was sitting there thinking, I'm like, I've learned a lot of new skills through these last 60 days as well. That's very unexpected. So I'm glad that you brought that to light as well.
You're very welcome.
Yeah, so I would just like to remind everyone that's listening that MDA does have a dedicated page on our website that will provide the latest updates on COVID-19 and information related to that. So you can go ahead and go directly to mda.org or by going to mda.org/COVID-19. Again, I just would like to say a huge thank you to Dr. Ambereen Mehta and Hillary Zebberman for your time today and for all the preparation that it took leading up to this. I also would like to say thank you to your institution, UCLA Health, as well. And also thank you to Mitsubishi Tanabe Pharma America for supporting us in this program. Lastly, I would just like to thank you for taking time to view this webinar today. We hope you found the information helpful and informative. If you do have any questions on this program or any of our other MDA Engage programs, please visit mda.org/engage. And with that, Dr. Mehta and Hillary, do you have any parting words for the ALS community during this time?
Just remember that with this pandemic, you're not alone, and that all of us, every single one of us, has to learn something new, to take a little bit of a risk, and to ask for help. And that's the most important thing, is to be able to ask for help if you need it, so that you can get your needs met and so that we can all get through this together.
Absolutely. And I echo that and just want to say how grateful we are to be able to care for patients with ALS who have really taught us so much along the way. And during this new uncertain time of coronavirus, I know we're all learning new things together and facing challenges together, but we know how hard you're all working to take care of yourselves, to take care of your loved ones and your communities. And so thank you for that. And we're in this together.
Wonderful. Well, thank you both again, and thank you for everyone who joined. And we look forward to hopefully seeing you again at another education event in the future. Thanks for joining.
Thank you.
Bye.